Hey there, welcome back to my channel. I'm Dr. Michelle Scoggins, but for the purpose of these videos, I'm the patient. So I'm talking about my hysterectomy. Today's video is all about the on-Q pain pump. If you have not had your surgery yet, this is a must ask of your doctor. I'm going to talk about in this video, what is an on-Q pain pump, right? How long does it last? What are the benefits? How much did it control my pain? What did it feel like to carry that thing around? And how did I remove it all on my own? So if you guys don't know what an on-Q pain pump is, it looks like this. Unfortunately, I was feeling a lot under the weather when I first had my surgery and didn't even really feel like taking photos of myself and what it looked like to have the on-Q pain pump. I knew I wanted to do this video, but again, I wasn't feeling well enough to even take that little snapshot of it. And so the on-Q pain pump is a device that you wear. It's like a little crossbody bag, and in it is a pouch about this big around when it first starts, probably about 2 pounds, I would imagine, if I had to weigh it. And it's full of localized anesthesia. And it goes directly into a catheter that they then, during surgery, insert in the place in your body in which your surgery was located. So for a hysterectomy, my catheter was inserted right at the top of my pubic hair. So a little hole right in there, and the catheter went in, and they had it all kind of tied down and all that stuff with good bandages and all of that. So I just carried it around like a little purse. When I got in the shower, I just had to put it in a little Ziploc bag and I had like a shower bench in my shower for the first shower that I took. And I just set it on this shower bench. And, but otherwise it just went with me everywhere. If the pain got to be a little bit more, and I think maybe once or twice I increased it, your doctor sends you home on a certain level, and then you're able to increase it for a 2-hour increment. And again, I think I did it 2 times. I think once the first day and maybe the next morning, like both mornings, the first 2 mornings that I woke up after getting out of the hospital. But after that, I left it on the doctor's setting, which was an 8, and it just played itself out. And on the 3rd day, it was completely empty and I removed it. And so I'll talk about that later on, of how I removed it and what was that like. So again, like I just mentioned, it lasts about 3 days. I don't know, that was what my doctor prescribed for me. So I don't know if there is a way that it could be prescribed longer, or if there are different sizes to the on-Q pain pumps, but mine was just for the 3 days. The benefits of this are that you get the localized anesthesia. So it goes right directly into the area in which they removed your organs. And so it gives you that centralized pain relief, where then you're not taking the narcotics. So I wasn't feeling like groggy, drowsy, anything like that. I was fatigued and exhausted from the surgery, but I didn't feel like I was going in and out of consciousness like you do with narcotics. I didn't get any nausea that some people do get with narcotics. I didn't get any of those symptoms that you get with narcotics. Then also, I reduced my likelihood of also being constipated, because that's the big thing with taking narcotics, is that you increase your likelihood of constipation. I was actually able to have a bowel movement, TMI, I know, on the 2nd day. And so that is typical after having anesthesia, but not always typical after having the narcotic follow-up pain medication. So I think for me, it benefited me by allowing me to be more alert, be more with it. I didn't take naps. I was back to my old self mentally within a day, and not physically, because obviously I was just really exhausted and fatigued. And so I kind of laid on the couch a whole lot this first week, more than I ever have. I've actually binged watched some series that I've never understood how people can do that. But now, after a surgery and you can't really get up too often, I found myself on a few Netflix shows, but we won't talk about that now. Um, Anyhow, that's been a huge benefit, is that I've just been more alert. And who doesn't want to be alert? Especially alert without pain. That's a huge benefit, right? And so it really controlled my pain. My pain has been a fraction of what it was before the surgery. So my pain level from day to day, just living with my uterus the way she was. And I found out now, the doctors had told me that my uterus weighed double what a normal uterus weighs. A normal uterus weighs 100, or excuse me, 60 grams, and mine was like 112. Well, there we go. She was a little chunky. So that's why, a big part of why it needed to be removed, because it was just giving me a lot of pain. So I had a lot of pain all the time, and it substantially reduced within the 7 days. So what did it feel like having it inserted into your body? Didn't even notice it. You had the catheter, like I said, inserted. So it was a little annoying. You have to wear underwear that doesn't get in the way of it, and pants that don't get in the way of it. And you're just really careful with that area, even though they have that thing, taped down like Fort Knox there, because I actually did get the catheter. The catheter is kind of long so that you can move the pouch away from your body at times if you need to, and you can, stick the catheter back in. But, sometimes it gets unwound, and it was hanging out, and it got caught on one of my cabinet knobs. And I thought I destroyed myself, but those band-aids were in place and nothing got destroyed. So I was perfectly fine. So just so you know, they really had that thing secured down, and it was minor. The biggest part for me was the weight carrying it around, and I didn't even think about it because I just carried it on one shoulder. But maybe if I would have alternated it throughout the days, it may have made it a little bit better. But I just left it. I never really touched it. I just left it on one side and just kept carrying it around. It was a little kind of a pain in the butt to have it at nighttime. But what really helped out, and if you watched one of my other videos about the essential items to have, the pregnancy pillow that I sleep with really helped out, because the pain pump, I could sit it right into the pillow and kind of secure it in between my body and the pillow, or even set it on the other side of the pillow to where it didn't really move around a lot, and I didn't have to worry about it getting underneath my body or anything. And so the pregnancy pillow really helped keeping the pain pump in place. So that's another benefit of having that pillow. And then on day 3, I was really excited to wake up, because I assumed it would be empty, given that the night before when I went to sleep, it looked a little low, and it was empty when I woke up. And you will notice it because, like I said, it's a big ball, and there's a cylinder in the middle of it. And as the pain medication goes into your body, it starts shrinking a little bit, and the outer cover starts getting wrinkled somewhat. And so then it starts shrinking down, and then you're left with just that cylinder in the middle. And then you can feel it, that there's no medication left in it. And so what I did was I started undoing the bandages. And, they told me at my doctor's office that it was really easy to remove. And I watched a couple of videos, and it looked simple enough. So I thought, what the hell, I'll just do it myself. And I went in and started taking the bandages off. But your doctor's office will remove it if that's something that you're a little squeamish about. I didn't think I could remove it myself personally, because I thought it would be painful, gross, whatever. But I really wanted it off that morning, and didn't want to wait for my doctor's office, or I didn't even want to get in the car to drive down to the doctor's office, because I was quite exhausted. So I gave it a try myself. Anyhow, I took the Band-Aids off, and I just lifted the Band-Aids around the edges because again, they taped it down into the pubic zone. And so ladies, if you are going to have this on-cue pain pump put in, and thankfully I do this anyways, and it was done, do some landscaping down there for sure, because you do not want this stuck to your zone. So just get rid of the problem, get the pain pump, and don't have an excruciating waxing session just to get it off. However, lift the Band-Aids up and then literally just start pulling the catheter and it comes out. The catheter was probably about this long that I pulled out. And I know it sounds kind of gross and I didn't really want to touch it myself. So I was kind of like, oh, okay, I got the thing out. Let's just like throw it in the trash. And that's the reason why I don't have it here to show you all, because I dumped it in the trash. So again, a piece like this comes out of you and you just keep pulling it and pulling it. Was not painful in the least. Didn't even feel weird. It just felt like I was pulling on something that wasn't even attached to my body. So pulled it out, popped, it came out, and I just kind of gracefully walked it to the trash can. And that was it. But this has been, I feel, a life changer for me to have for the recovery of my surgery. And I think that it's helped my surgery process and the recovery process go a lot smoother, easier. Again, I feel so much more alert, and it reduced all of those things of being constipated, being groggy and out of it. And this is something that my doctor didn't even give me a choice. He said, I'm putting this in and that's it. And I didn't know much information about it before he talked to me about it. But I see that not a lot of people are offered this or know about it. And so if you are going to have a surgery, I say, make sure that you talk to your doctor and ask for this specifically. And I hope this video has been helpful for you. If you haven't gotten your surgery yet, please inquire about it. Watch my other videos that walk you through this whole process that I'm going through. I hope it helps at least one lady as she's going through her process. If you have any questions or would like me to make a video about some part of my process, feel free to jump into my comments. I would love to do that for you guys to make your process a little bit easier. And with that being said, I hope to keep making these videos so that I can educate people and not wait to get the surgery done because of any sort of fear or apprehension about getting it. So be well, guys, and I will see you soon.